welcome back to Concerning the Community, in our continuing series on talking about the drug abuse initiatives that are going on here in town. And I have with me again Captain Dean Rondeau of the Wolfeboro Police Department. He's become like my best friend in this program. Welcome back.
Hey,
And I
thanks.
also
It's good to
have
be
here today, I also have Melissa Fernald, who is from Safe Surroundings. She's a licensed clinician and substance and drug abuse counselor, and she's a part of this new initiative that the Wolfeboro Police Department is putting forward in terms of trying to, as we were saying earlier off camera, stem the flow in the issue with heroin abuse and drug abuse in general. I would say, I mean, I feel like heroin's the key word, but it really is so much bigger than that. I think
It is indeed.
yeah, it just seems to be
That's what everybody.
the word of the
day. That's
yeah.
what everybody is focusing on. But it is indeed more than heroin. And before I turn it over to Melissa, I just want to say one of the interesting phenomena that we're seeing right now is a huge abuse of fentanyl, which is an opiate, very molecularly similar to heroin. It's used for many of the same purposes that you would use OxyContin. A little bit different characteristics in how it performs in the body, but I think one of the problems is that we have a lot of heroin abusers who think that they're shooting heroin and they're shooting fentanyl, or they're shooting heroin laced with fentanyl, and and that is what is really causing a lot of the overdose deaths, or at least our take on the street, our take on at the Wolfeboro Police Department is that is indeed the case. Melissa?
Okay. So first of all, just going back just a little bit, last week when we talked, we sort of started introducing this initiative that you're doing. One of the pieces is that once an arrest happens, that's when Melissa comes into play, and there's a meeting involved within a certain amount of time that said person who's been caught, we'll say, has to meet with her. And so this is where you step in, and you then do what?
Well, the first thing I would do is the telephone contact. It's the first communication with the referral person. Client. I will refer him to as client after this. So,
right.
At that point, I will communicate how the process is going to go, and then ask them if they have insurance. And if they don't have insurance, I'm going to try to work with them over the phone to connect them with some of the resources in the state, such as the Medicaid expansions, and those kind of substance abuse medical insurance, so that they can get services even beyond me.
Right.
So that would be the first thing I'll do over the phone. When they come into my office, what I will do is I will first process with them the events that happened that led them to my office. And then I will administer a biopsychosocial assessment and say evaluation.
Say that 10 times fast.
I know. What it is a full-scale evaluation, and it will evaluate, not just assess. It will evaluate for substance abuse problems. So what is the extent of the problem that they're presenting with, whether it's heroin, marijuana, alcohol. So this evaluation tool will be able to tell us at what level the problem is at, which is very important. It will also determine if there is a mental health diagnosis, any physical problems that they're running into. So multiple risk factors will be evaluated, and then I will be able to come up with a recommendation for what level of care this client needs from this moment on to reduce their risk to reoffend or become clean. And at that point, I will process with them the results right in the moment, and then what I really would like to do is work with them to refer them to services.
Right.
For them to have treatment, whatever their level of care is. And the level of care is really important because based on the evaluation, when we look at level of care, is that do they need detox? Do they need a rehab program? Do they need intensive outpatient, or can they have outpatient treatment? The problem we're going to run into is New Hampshire doesn't have a lot of those resources that the level of care may come up with.
Right.
And so it was going to be a dilemma. So my hope is that we can get some more people on board to help us as we refer out for services. And at that point, they will be referred out. I wouldn't take them on as treatment. I may end up in the interim while they're trying to get into placement. That may be something that I would be willing to do. It will depend on the motivation for with the client. So basically, that's what I do in a nutshell. But I think it's pretty important that people understand that even though they'll be referred to me by the police department, the moment I talk to them on the phone, everything is confidential.
Right.
And that's beyond HIPAA. That's what we call 42 CFR, which is a federal law that protects everybody who comes in for drugs or alcohol from the age of 12 on. So,
and Captain Rondeau spoke to that in our last program too, saying that, you know, it works together, but yet it's still separate, because it's not, you're not reporting back to them what's going on. It's really just one of the other pieces that fits into the whole thing. And I think it's important that people understand that it's not, I mean, you guys are working together, but it's different pieces in the puzzle.
Absolutely.
Yeah, that's correct, and just let me expand upon that. She's really, if you will, in simplest terms, she's really doing, I'll call it the medical piece, or the treatment piece, or the clinical piece to this, and we're doing the law enforcement piece and the prosecution piece, and never the two shall meet. Never the two shall meet. So even though and I'm going to use a word very carefully here, or a term very carefully, even though Melissa is acting as our agent, so to speak, okay, as a descriptive to try and explain, what she's doing is she's doing her job, which is to, hey, let's identify where the issues are, let's identify the nature and scope of the problem, let's get that person pushed into some sort of treatment program, and then that's where it begins and ends for her. You know, and she's not reporting back to us, and in fact we don't want her to report back to us. We're not interested in that. What we're simply interested in doing is stemming the flow of the addicts that are in the pipeline, because we see this as one of the lines of effort to reduce the overall drug problem in the community, and to reduce the number of opiate addicts that we're dealing with in this state. You've got to stem that flow. And you're not the way we've been working this since 1973 is not working. It's just clearly not working. We're not having the impact that we need to. So we have to do something else. And as I said earlier, we're not going to arrest our way out of this problem. We've got to stem the flow. Certainly, law enforcement is a line of effort. But treatment, education, prevention, we have to stem the flow of the addicts. We gotta shrink that pipeline, if you will. We have to reduce the number of addicts that are out there, and this is a method of doing that.
Yeah, because it's already been, I mean, it's been out there for so long already and already happening. So not only do you have to get at it from a preventative nature, you know, as we talked about in previous shows, in terms of, you know, educating the young ones and bringing them up and that sort of thing, but now there's well, it's already happening and in place, and so you have to move forward from that and find a way to attack it.
That's correct. Just let me add one other piece, because and in fact, just real quick, I was just looking at some recent numbers coming out in terms of overdose deaths in this state, and you know, right now it looks like we're having one a day. Somewhere in the state, we're having one overdose death a day. So think about that for a second. Okay, in the state, we're having one overdose death a day. That's what we're having. So, of the approximately 2.5 million residents, citizens of this state, our state is being depopulated by one citizen every day, and that number is about pretty consistent to what it was last year. I think the total number was somewhere around 360 overdose deaths. Now please understand, that's all overdoses. That's all overdoses.
Right.
Okay, but the vast majority of that, 90% or more, was some sort of opiate, whether it was heroin itself, or whether it was fentanyl or Oxycontin or methadone or Valium or some other opiate or combination of opiates. That's what we're seeing. So there are some out there that would say, well, eventually we're just going to run out of addicts and they're all going to die. No, it doesn't work that way. and don't think like that, because that's bad logic. That's really bad logic. If we do nothing to treat those that are afflicted with this disease, if we do nothing to stem the flow of those would-be addicts that'll be coming into the pipeline, okay, you will constantly have this problem. And then we won't have, in 2016, we won't have 365 overdose deaths. We'll have 700, and in the following year we'll have 1,600, and so forth and so on. You see where I'm going with this now? I mean, those are very rough numbers, obviously, and I have no idea what we're going to have in 2016. But the point I'm getting at is you got to stem that flow. All right, and treatment alone isn't it. Enforcement alone isn't it, and education prevention isn't it. All three lines of effort have to be equal and measured, getting at the problem. And this initiative really, I think, speaks to two of those. It speaks to treatment, and it speaks to prevention, education, and we're cleaning up those that are in the pipeline. And that's what I really. That's really the.
It's enforcing an option that is already there, if you will, for those that want it. Yeah, it's always been in existence. I would say, treatment is certainly out there and available, but this is sort of saying now we're now giving you this option. Like, this is,
exactly.
If you're going to get caught, we're going to make this part of the deal.
Her functions really speak to, when you look at that slide, that we have the drug problem over here, they speak to getting at the root causes. Is it undiagnosed mental illness? Is it undiagnosed medical issue? Is it some other psychological issue that we're not cognizant of? What are the underlying root causes, and addressing those root causes? And we're doing it individually, but we're doing it, and we're speaking to getting it done. It's speaking to addressing the problem, not just treating the symptom. Oh, you've got an injury, let's put a Band-Aid on that. This is not a Band-Aid. This is a treatment. This is a remedy. It's time consuming. It's expensive. But we've got to get it done. We've got to do it. And this is what, when I've spoke a few months ago at the Carroll County Public Health Initiative on this, when I said this is really going to be expensive, and a lot of people looked at me, and I said, no, this is really going to be expensive. Nationally, think about the expense nationally to do this.
Right.
It's huge. It's going to be huge for the state of New Hampshire. It's going to be even larger for obviously for the federal government. So, but we've got to do this, and this is a generational issue. There's no easy fix to it. I mean, I think the solution is fairly simple, but getting that implemented is really going to take a long time. And it's not going to take a long time because nobody wants to do it. I think there's plenty of people that want to do it. It's going to take a long time because this is a generational issue.
Can I
absolutely.
I understand what you're saying about it's going to take a long time. From my perspective, there are things that we can be doing, such as this, and multiple other things in our communities that we can be doing today and tomorrow. And that whole piece that the community is waiting for that money from the government to come down and for money to come in so that we can start to do something, I think that we need to set that waiting aside and do something as a community. We need to work together, which is why I joined this initiative, because Safe Surroundings has been about educating adults on being able to detect the warning signs of early use. And so that has been my focus. But as someone who lives and works in this community and watching one person die after another of heroin overdosing, I really felt like it was my responsibility as a member of the community who has the skill set to be able to do this, to do something. And I think that there are a lot of people in the community have skill sets and lots of different things that they could offer to combating addiction, not just heroin or opiates, but the whole issue as addiction as a whole, whether it's teenagers or young adults. One of the things that has been happening is we've been seeing this heroin epidemic grow for the last several years now. But I have to tell you, as a master's licensed alcohol and drug counselor in this community, and one of two within like 50 miles of here, I have not received referrals for people who have heroin addiction, whether it's from the police department, whether it's from the courts, defense attorneys, hospitals, DCYF, they weren't coming in. The ones that were coming in were from a program called the HOPE program, and that's a diversion program that reduces sentencing. It's almost like a drug court, if you will, but a little different. It has a treatment component to it, and they track it. But other than that, I have not gotten the referrals, which has been really frustrating. Why?
Well, and I think, and you spoke about this a little bit earlier too, and that is, again, with this particular initiative and what you were saying, this opens up that window of time where people are willing to talk and they're willing to address it. And I think, up until now, maybe not enough of that has been happening. I mean, I've, in talking to a lot of different people and that sort of thing, I've noticed it's like people are not willing to come forward. And this is sort of forcing that and giving you that window of time where people are willing to be open to change and treatment and those sorts of things.
You're correct that people aren't necessarily willing to come in, and it takes something like this. However, some responsibility does need to be put on the whole community as a whole and the whole system. So if you have somebody that's getting a Narcan shot because they've overdosed on heroin, they're brought into an ER hospital and they're just medically stabilized and then released. No treatment intervention, no referral for services, opportunity for change was missed that time.
Right.
So it's about creating that systems to start to intervene early as we possibly can in those moments, embracing those opportunities for change, which is how I view this. And I would really want to use this to motivate a whole system change, at minimum in this area. And that would be my goal as a educator and a clinician.
Well, and that's one of the reasons why we're here and we're doing this, is because so much of it is about raising awareness and making people understand. So it's about saying, like, you as a community member, if you're seeing it, what the things to look for, what to know, because as I said in our last program, I think what people are now just starting to understand is that this is not an out here problem anymore. It's literally right here, and I think that once we can get over that hurdle, then, people become more aware and more understanding and can start moving forward with that stuff and being more preventative.
While you're on that topic, and that's a nice segue to something I was going to bring up and to tie into what Melissa was saying, but what you just pointed out, just so we know, and people may not be aware, but since January of this year here in Wolfeboro, we've had 5 of our citizens have succumbed to some sort of drug overdose. Now, in some of those cases, which are still being investigated, I'm not at liberty to discuss that, but the toxicology is still pending. Other cases we know it is an opiate, or a combination of opiates, or drugs, known as polydrug use in law enforcement, which is accounts for about 45% of our drug abusers are polydrug users, meaning they're using multiple drugs. So what do I mean? They're using marijuana, they're using alcohol, which is a drug. They're using, all at the same time, they're using an opiate or 2 opiates. And so we're finding these combinations of drugs in their system. But in Carroll County, and I just checked the stats on this before coming down here, and the numbers are as of 31 July, so they're a little dated. But we've had 214 Narcan administrations within the county. 214. So let's talk about that for a second.
For those who don't necessarily know what that is, we're going to go layman's terms here for a second. What is a Narcan administration?
You want me to?
Yeah, please.
What it is it is a drug that reverses the effects of an overdose on opiates, not just heroin, but opiates. It is given either as a nasal spray or as a shot. And when it's given, the effects of it, sometimes they'll pop right out of it and come up, standing up, and it reminds me a lot of an epi pen,
Right.
whereas you give the shot, but it wears off. Epi wears off in 20 minutes. The Narcan or naloxone lasts for 30 minutes, and then it can go back into the overdose. So as we're giving them to caregivers to help them combat this overdose issue, we have to be really careful in making sure we educate the community that you need to call 911 the moment this is happening, and so that they can then come in and take care of what needs to be taken care of medically.
Right.
You know, but that's, I mean, they're dying. They could be dead, and then the shot will reverse it. So you can see why that is a huge opportunity for change. When people talk about they hit rock bottom, that whole cliche.
Right.
I don't think it gets any worse than dying and then being able to be brought back to life.
Right.
We're missing that opportunity.
Well, and thank you for explaining that, because you know, these, it's, once you are around it for a while, you understand all these terms, but again, we're in a point of trying to help people understand it.
But
so
new
it's
to all of
important,
us.
exactly, so it's important that everybody understand what these multi-pieces are.
Let's talk about that number for a moment and why it's important to us, and why it's very important to Melissa, is because 214 now.
And that's statewide.
No, that's Carroll County.
That's Carroll County.
State's much larger.
Okay.
Yeah, that's Carroll County.
All right.
And that's what I'm getting at. That's Carroll County. Right now, I just really only want to focus about Wolfeboro and Carroll County. Absolutely. So we have 214 as of 31 July that I've seen reported, and as Melissa said, that is something that is given, it's administered to the addict when they are essentially dying or they are dead. Okay, that isn't something, I'm going to take a Noxian shot because I'm going to go do heroin. No. This is something that has been administered probably by fire rescue, attending EMT, or, as Melissa said, a family member said, oh my God, and they've administered that shot or that nasal spray to try and bring the person out of the throes of death. Now, some of those, of that, I suspect, are multiple administrations. The first one didn't work, so we're going to go into a second one, and perhaps even a third. But still, by and large, 214. So we've had, theoretically speaking, as of 31 July, 214 overdoses in this county.
Right.
Where people have had a near-death experience or a death experience and have been brought back because the drug was able to get into the system and bring them back. And that number may be a little bit less than 214, maybe 210 or maybe 200 or so. But the point is that that's a lot of people. When you consider the population of this county is 33,000, and as of 31 July, we've had 214 overdoses. If that Narcan was not available,
right,
that would probably be pretty close to 214 deaths.
Yeah.
Okay, and so that's what we're really talking about here, and that's, I had somebody ask me the other day, said, hey, is it really a problem? I mean, is it a lot of hype? No, it's a problem. And when you're looking at numbers like the Narcan administrations, and you're looking at the numbers of overdose deaths in Wolfeboro, one community, one small community in the greater Carroll County area, and you're looking at five young people that have perished as a result of this. Yeah, these numbers are significant. They are significant, and we need to somehow reverse this. We need to check it. Okay, and because if we don't, then those numbers this time next year will be 10 deaths and 500 Narcan administrations this time next year, and that's what we don't want to see, and that's why. And of that 214 administrations, and what Melissa's saying I think is kind of important, is to date she's had 0 referrals as a result of that, and that's kind of significant.
And the other LADEC has an as well.
So that's kind of significant, and so programs like this are very important, saying, hey, we've got this program in place, and we're putting it in place, and we're moving forward, and as Melissa would say, hey, we're moving quick, and we are moving quick.
Yes.
And because we know how important it is, and she knows how important it is, and we're trying to get the word out there. But that's what we're trying to do. One, we're trying to change awareness. Two, we're trying to educate. And that's really the points I just wanted to bring up, because I think they're very important. And those numbers should be very sobering, no pun intended, to the audience.
Yeah.
Those numbers ought to be very sobering.
Yeah, absolutely. Well, I mean, just alone in me realizing it was a county thing and not a state, state.
Those aren't state numbers, and I think when
Well,
if you saw the state number, if you saw the state number, I mean, that would be, I think 214 would probably be, I'm just taking a guess now, I'm going out on a limb, but that'd probably be like maybe Manchester and Nashua to date. So now you get to see the sense of, I want to say, I seem to recall Laconia was 129. Just in the city, so
in other areas.
So I mean, and those are just one, that's one city town in Belknap County, and I thought it was 120. I could be wrong, but I seem to remember that number 129.
Had, I believe the Franklin chief mentioned at the Narcan meeting in Waterville Valley last week that they've administered about 200.
Yeah, that sounds about right. And actually, 129 is actually pretty good. I thought that'd be a lot higher for Laconia.
Right.
So I was actually, wow, they're doing a good job over there. They're driving it down, and it's sobering when I'm looking at the numbers on a scale, and it's a metric that I use to try and figure out where is the problem by county, and I'm looking at Narcan administrations. I go, wow, Laconia is driving the problem down. There's only 129 drug overdoses to date.
And that we're in a place where we're like, oh, there's only 129. I mean, this is why I'm here and I'm doing this, because you have to listen to how we speak right now.
Right, exactly.
How we have to talk about this.
Exactly.
It's so eye-opening. It's so incredibly eye-opening. So, all right. So I know, obviously, this has all been very new. You just introduced this, at the commission meeting. This last month?
A couple of weeks ago. Sure.
Yeah. So this is still, again,
it's
moving fast, but
infancy.
It's getting out there and it's happening. Have you already been able to put it into place?
Not yet.
No.
Not yet. But I think any day now. We're still working out. Like anything else, there has to be some.
This is organic. I
yeah.
mean, obviously you have a set plan and you've put it out there and we've showed that, and there's lots of moving pieces to it and everything, but it's still very organic.
It is.
Because as you get underway with it, you're going to probably find different.
This has never been done
hurdles,
before.
bumps.
No,
this has never been done before, and we definitely have. We have to have some agreements, and we're still working on that, negotiating our way through that. But it's going to happen, and we're going to find the common ground where we can. We're going to move forward, and as Melissa said, we are moving quick, and we are indeed. In fact, you were just talking to Jack Wozniak.
Yeah, I reached out to Jack Wozniak.
Is the drug czar.
He is the drug czar for the state of. I'm sorry, John Wozniak. Let's like Jack.
Well, I did.
We're on a first name basis with him.
We are.
And
I shot him an email to let him know, we need to coordinate with you, because there have been a lot of funds that have come in recently, grant opportunities from the government as well as SAMHSA, who is the substance abuse national provider. They provide a lot of grant funding for programs. So money has come in to start to tackle, earmarked to deal with the heroin epidemic at different levels. And so I think that it is important that initiatives like this be able to access those funds. But how do we in Wolfeboro over here get into the State House to say, hey, do you think we could use some of that money so that we can provide treatment?
Too. Yeah.
Because the treatment it's going to be tough to get the funding for the treatment, especially if they don't have insurance. And even with the insurance, some insurances don't cover some of the services that that are out there. So it is really important to do that. But it is in the infancy phase. But I want to point out that now that the story has come out, and and Safe Surroundings has been posting the initiative on Facebook, Twitter. We're putting it out on the social media. We're getting it out there. What I'm noticing, the response on my end has been overwhelming. And what I've been seeing is people saying, "Did you see this? Oh my gosh, there's services." So let's say We're still
See,
ironing
and
out
this
the
is
tweaks.
exactly what I'm saying.
They're
like,
gonna
this
call
is like
me.
people are
They
going,
can reach out
oh,
to me now.
and
We didn't know she was
and
here.
it's always been there, you
Oh,
know.
yeah.
And so now again, it's like we're just raising that veil and
Awareness.
saying it's
Mhm.
happening, it's here. You know, it's big. It's so much bigger than people
And
realize.
there'll be more coming, other than just this. I mean,
Yeah.
you know, I have a program that will tackle that awareness for adults, especially given some of the ages of some of the overdoses that we've experienced in this area, and the fear from adults and parents. You know, what do we do? How do we avoid this? Because what's happening is this heroin epidemic is overshadowing, and deaths are it's important to tackle the issue. However, what's happening, a lot of us are afraid of, is that underneath the heroin addiction, the next progression of use is coming up. You don't just start with heroin, okay? It's a progression. It's a substance use is a progression. So when you get to the point that you're using heroin, okay, there were multiple opportunities where interventions could have happened prior to that, whether it's law enforcement, medical, parents learning how to communicate with their kids, being able to detect this early. So that is one of Safe Surroundings initiatives. And so bringing in the heroin piece to motivate those other opportunities is so important.
Yes.
To empower
Absolutely.
parents, to empower the community to be able to say, you know what, this is our community, and we can do something. And guess what? If I have to be that springboard that helps people, and if the police department needs to be that springboard, then we will be it.
Right.
And it needs
well,
to
and
happen.
and again, then that's one of my whole reasons for being here and doing this and breaking down these pieces. And I would be more than happy to have you back and sort of start putting some of that out there, if you know, if you want to just be able to have that discussion, and obviously to invite Officer Cooper in too as the school resource officer here, to be able to talk about those things and what's being done, because you know, I think it is becoming important. It just is in general, you know, and sort of parents, and sort of like, okay, I'm reading about this now. What do we do about it? Or obviously, because it's
and those of us in
it's
the field,
everywhere.
we know.
Right.
I mean, we've been sitting in forums listening endlessly
Right.
to everybody talk about what the problem is, and it's becoming increasingly frustrating. And so people like us are like, you know what, time to get down to business here and focus on some solutions and start doing something about it. And that's important.
And I agree with that, and I suspect that with our program there'll be some speed bumps and some hurdles and some roadblocks and obstacles that we'll overcome, you know, and you know, we'll overcome those. We'll blow the roadblocks and we'll bridge the ditches, and we will, you know, move slowly over the speed bumps, and we'll keep going down that road, and like anything else, you know, we have a plan. And when we run into these obstacles, the plan at least gives us something to get back onto, like a roadmap. So if you have to make a diversion, but at least you have a plan and you know where you're going, and that's really the important thing. Is, and I think we're ready to do something, and that's what this is really all about. So I'm very excited. I think it is a new initiative that nobody else is really doing other than Laconia of sorts. It's certainly a modification of their program, and I want to give them all the credit in the world for thinking about this, and it was so blindly obvious, you know, blindingly obvious. I'm surprised I'm surprised I never thought of it. But what a great job done by the Laconia PD and Officer Eric Adams. And
I think, I mean, and you know, I guess from my perspective, I hope that it becomes the domino effect. In a good way, you know, if they put forth this program that you guys adopted and modified, and are now putting forth your own, and so one community after another now has an opportunity to go by and say, okay, here's what Wolfeboro's doing,
and just
how can we modify,
and setting some
know,
numbers,
and,
setting some numbers from them. Now these numbers are a little dated; they're about 3 months old. But when Officer Eric Adams briefed us, 36 of the referrals that he had made to you know, somebody like Melissa, a licensed drug and alcohol counselor, you know, a treatment provider, 22 were in a program. You know, so I think that's huge. That's, you know, approximately 2/3, right, in that neighborhood. You know, pretty damn close to 2/3. Those are great numbers. I mean, so 2/3. So think of it like that: 2/3 of the addicts in the pipeline over in Laconia have been removed from the pipeline and have now been put somewhere else with 2/3 of those referrals. So that's huge. And you know, and he even said, look, we've had a few of these have relapsed, and we put them right back into the program, and they you know, they're moving forward, and they're going down that road to recovery. And I think that's huge. And so there's 22 lives that have been positively affected by this initiative, by this effort over in Laconia. And I suspect that I suspect that most heroin addicts or opiate addicts, and when we say heroin, we're really talking opiates, right? That's what we're really talking about. So you're talking about, you need to know the way we speak. When we say heroin, we're really talking opiates, because it's all the same thing, right?
Right.
I think many of the people that are addicted to opiates don't want to be addicted, and they want help, and they're just waiting for someone like Melissa to say, hey, let's talk about this, and let's see what we can do to help you. And I think the response, once we start getting our referrals pushed in that direction, is going to be overwhelming.
Yeah, I agree. And I think a lot of us work in you know, compartmentalize the issue, which has been the problem, is that every different discipline is working in a little box. So you have the police department dealing with the issue, you have the school department, so you have everybody's dealing with the issue on different boxes and trying to come to solutions in different boxes. And
everybody
now
needs to
we
be
need
in the
to
box.
all be in the same box, and start talking about the solution and not the problem so much anymore. But one of the things we know about recovery is that every interaction we have with somebody who's suffering from at the hands of any addiction, whether it's opiates, alcohol, methamphetamine, cocaine, whatever it is, that every conversation we have with them is an intervention. Or, you know, as a parent, when you see something with your son or your daughter and they're using something, that they may not stop using right in that moment. You know, like with Laconia, 36 people, 22 ended up in, you know, staying in treatment. You're planting seeds with everybody. So recovery is a process, and it is a grueling process. It is painful, it is lonely, and it just is tough, okay? So, but with each intervention, each conversation, you're planting a seed. And then, once the time comes, when that moment of awareness or enlightenment for that person, is all those interventions, all those experiences come together, and then their motivation, everything, it goes much smoother. So I think it's important for people not to focus so much on numbers per se, as far as like, this is working or that's not working, but that overall, the amount of interventions is what matters.
Right.
It is. Because, you know, some are going to, that moment for them is that. But I think that's the important piece.
And I think in the term that you like to use is the whole of society. I think the whole of society is in a process of recovery in terms of understanding this and moving forward from it and trying to work at, as you said, solving the problem.
It's been traumatic for our community. This has been watching and reading the newspapers, reading people's comments when somebody's died of an overdose. It's been very traumatic to read all these stories, hear about it on the news, hear about a death, hear about a child that witnessed a death. And I always tell people that you can't put more fear into this community. There's enough out there. We're traumatized. We're traumatized by this crisis. And that's why it's so important for TV stations like yours to start to put that focus and put some hope back in there, so people can start recovering from this crisis that we're going through. And that's really kind of how I view it.
Yeah, I'm all about, you know, it's okay to talk about it and understand it and try to understand those pieces that are coming on. I mean, I'm still learning new stuff as we go through this process. I mean, you see
we all are.
Yeah, and I think it's important for everybody else to do it too.
The state has both a Facebook page and a website out there. It's Check the Stats New Hampshire, and on that there's a lot of resources, and there's some PSAs on there, and some videos, some video vignettes of recovering addicts and parents talking about the loss of a child. And I think, and I know you're a parent, and you have young children, you really ought to take a look at those. And you ought to watch them. They're not long, they just take a few minutes, because I think they're very important, and they speak to what you were just saying about the education piece and about understanding and having discussions about the problem. And I think Melissa's absolutely correct. I think we need to have discussions about these problems, and I think that the part of what we're doing is providing hope back into society that, yeah, we have a problem. We need to understand the problem, because before you can solve the problem, you need to frame it, right? You need to frame the problem. You need to identify the problem and look at its root causes and so forth, and then you can come up with a strategy, a campaign plan, if you will, to get at the problem. And part of that requires understanding, and understanding through other people's misfortune, looking at what mistakes have been made, looking at how these problems came about in the first place. So I would encourage your viewers to Google, check the stats, New Hampshire, and there is a Facebook page on that as well, where the same PSAs are available, and you can look at it. You can look at the numbers from the CDC on the reporting nationally, the heroin problem in the United States, the opiate problem in the United States, as well as New Hampshire, and so that's very important. But I think it begins with the family.
It does.
Moms and dads, and this is just moms, as dads need to have discussions with their sons, with their daughters, with their loved ones, and they need to talk about the dangers of alcoholism and drug addiction and so forth and so on. And that is so important. So it really does begin with the family, but it is a whole of society approach, and everybody needs to be speaking about these different themes, and it needs to be inculcated in our younger generation, so we stem that flow. Everything is really directed at stemming the flow, and if children hear it enough, it will resonate. It will resonate, and that's really my point, because I'll tell you right now, we're not going to arrest our way out of this problem.
Yeah, and it's important that you keep saying that.
Yeah.
Absolutely.
Well, by the time it's a legal issue,
It's too late.
they have a problem.
Yeah, it's too
Right.
late.
And that's the piece that I've struggled with for a number of years, which is why I started Safe Surroundings, because by the time teenagers were making it into my office, they already had a problem, and because of their brain development,
That's
recovery concepts are really hard to instill in their developing brain. So I really felt like I needed to do something to increase the awareness and give parents tools to be able to intervene if they think their kid is using, and to have those conversations before things happen. But one of the biggest statistics that, probably one of two statistics that I even talk about, because I like to talk to people, with people, about real stuff, but is that the number one deterrent of teenage addiction and use is parent disapproval. That's the bottom line.
Yeah,
So
Right.
parents
absolutely.
being clear on this is unacceptable across the board, and not picking and choosing.
Yes.
It's okay if you smoke a little weed because it's not bad for you, or you can have a few drinks. What the teenager hears when you say that is, everything's fair game, my parents are cool with it,
Right.
and thus that increases the chances of them using, which then increases the chances of addiction.
Right.
So,
She is spot on.
Well, and I think
She
Sorry,
is
I had to go
absolutely
there.
spot on.
And it's
I had to
that's
go there.
perfectly fine. And
Sorry.
it really and I think it's a great
Oh.
place, a great stopping point for us here at this point, because I feel like that is a whole other topic in and of itself and related to this, and that's why this is ongoing and in multi pieces, because we could probably sit here and talk all day about all the different facets of it. So I want to thank you both for being here.
Thank you for having me.
As always, and I'm looking forward to continuing the process and educating everybody and just raising awareness about what's going on, because you guys are doing great things, and it's a pleasure to be able to be here and talk with you guys about it. So
Awesome.
thank you very much.
Thank you so much.
yeah.